Okay, here we go. Kinesiology 230, still chapter 2, talking about structure and function of the cardiorespiratory system. This is presentation 4. We're going to basically do a review of some of the material we just went over regarding cardiac morphology, and then also talk a little bit more about circulation. So it's going to be a little bit of a retread, but there's some new info in here as well. Now, we talked about deoxygenated blood, how it returns to the heart via the superior and inferior vena cava, and we went through the etymology of those terms: superior above, inferior below, vena meaning it's the vein, cava because it looks like a large cave. A little bit of coronary sinus too, so there's a return from the vascular system that services the heart to the right atrium, but that's left out in the book. We talked about the pressure differential that we see in terms of the lowest pressure in terms of blood pressure is seen when blood is returned from the body into superior and inferior vena cava, and then the blood pressure is the highest in the aorta as the ventricle squishes to push blood out to service the rest of the body. And we also talked about partial pressure of oxygen being highest here, partial pressure of oxygen being lowest here, but conversely, the partial pressure of CO2 is lowest, partial pressure of CO2 is highest over here. So just kind of keep that in mind as we go through this. So we had the 4 chambers. We talked about the atrium and the ventricle. We have the atrium, or like the atrium you see in an entryway with a glass ceiling. So that's on top. That's what gives us the visual for the atrium. Then the ventricle, it vents the blood out, squishes the blood out, however you want to think of it. We have myocardium, which is the layer of cardiac muscle. Arteries carry blood away. So you can think of it in terms of arteries away, AA. They both begin with A. And then the other way to remember that veins bring blood back is deoxygenated blood returns to the heart via the superior inferior vena cava. Think vena, vein. All right, a refresher here for you. So where this becomes confusing sometimes is the exchange that you have. Blood comes back to the heart, but it has to be serviced by the lungs. We have to have an offloading of CO2 and we have to have an onloading of oxygen. So what happens is blood is sent away from the heart through the up here. Excuse me, I get my mouse up here. Blood is sent to the lungs via the pulmonary arteries, if I can say it correctly, and that process happens like this. Deoxygenated blood, inferior and superior vena cava. You have the right atrium, dumps into the right ventricle. And remember, we're looking at it as this was sitting in a person's chest in front of us, so it's the right side of their body, not ours. The right ventricle swishes the blood up and out to the left side and the right side, and that's done through the pulmonary arteries. And this is where students many times get tripped up on a test question because you have blood in the heart and you're thinking artery and veins, and then the question that comes back is usually this: oxygenated blood, true or false, returns to the heart from the lungs via the right? And you know that oxygenated blood does come back to the heart. So you have both deoxygenated blood that comes back to the heart through the inferior and superior vena cava, and it's through the veins, and you also have oxygenated blood that comes back to the heart through the veins, but it's from the pulmonary side of the equation. It is or are the pulmonary veins that bring oxygenated blood back to the left atrium of the heart, to the left ventricle, that then squirts the blood out through the aorta. So that is a test question. 100% you'll see, whether it's my class or any other class going forward, when they start asking about circulatory system in the body and oxygen exchange, that'll be one I can 100% guarantee you will be at every test you'll see, because that's when it's a kind of a trick question, right? Because you're talking about veins bringing blood back, and it's oxygenated blood from the lungs, but it's deoxygenated blood from the body. All right, moving on. So with this, it's a pressure-driven system, and blood flows in terms of millimeters mercury in the aorta. You have 100 up here, and then 60 in the arterial, so on the other side. So what happens is the red line has a higher pressure, the blue line has a lower pressure. The red line also has a higher partial pressure of oxygen, and the blue line has a higher partial pressure of CO2. not to confuse those, but realize that overall, because of the squishing and the adaptations we have in our bodies over evolving over generations, this becomes stronger and stronger and stronger to squirt blood out to service everything in the body. But by the time it gets back to us, it gets less and less and less. And I would say take a read to I'm going to put a document up. It's something I wrote for one of my classes regarding kind of how the pressure gradient happens within our bodies. Very much you have like a plumbing system in the house, but also like when you talk about the river system that you see and how a river itself feeds out to a delta. And though it's the same amount of water, the pressure and the force of the water is a lot less because it's spread over a much broader area. Anyways, on the return side has they have valves, and they're one-way valves. And so as the blood goes through, the valves open, and when the blood tries to come back down in, the valve snaps shut. So it does this and this over and over and over again. It's very much like a check valve you'd see in plumbing, like in your house, to allow water to flow one way but not the other. And the contraction that you have, and I talked about before, like having active recuperation and having our athletes move around a little bit. Now, the active recuperation you have after a strenuous workout, yes, allows the individual to have increased blood flow, also bring more CO2 to the lungs to blow off CO2 and onboard more O2, but also the moving around, because of the contractile mechanism of the muscles, by moving around just a little bit, causes this kind of like contract, relax, if you will, kind of ringing effect of the vascular system to push blood back to the heart so it can be serviced. So you want your people moving around a little bit. If they're laying around on the floor, they don't have the benefit of this contractile mechanism to help shunt or push blood flow back to the heart and therefore the lungs to be able to blow off CO2. So as it moves through the system, the vascular system itself, it also has phasing of constricting and dilating. By constriction, we mean getting smaller and smaller. By dilate, we mean bigger and bigger. And so you have this that happens in the actual vascular system. And as blood is pushed through the entire system, leaving the aorta all the way through, coming around back to superior and inferior vena cava, there's resistance that's offered in the vascular system. And you have the cumulative total as total peripheral resistance, meaning how much resistance is being offered by the vascular system. And for some people, they don't have the ability to constrict and dilate, right? They've lost their elasticity. They also have maybe plaque on the inside of that vascular system. And so as a result, they've lost the ability to have the constrict and dilate, but what ends up happening is they have a greater amount of resistance to blood flow as it goes through the system. Now, I throw this out here, and I like this, and I think it's good, and I think it's something that you kind of have to kind of wrap yourself around. The ANS, the autonomic nervous system, controls the activity of the organs, right, such as the heart and blood vessels. And with the two branches, you have the parasympathetic and the sympathetic, and you have one, the SNS is very much that fight or flight. The parasympathetic is the rest and digest. And so you have this kind of balance that happens between these two, and they help to regulate heart rate. When the parasympathetic system is active, right, and we're at rest, and we're in rest and digest mode, the heart rate is downregulated. It's a lot slower. And the actual heart rate itself will have a little bit of variability. If you're familiar with heart rate variability training, HRV, what you're talking about is the distance between an R and another R, and I'll talk more about this in the presentation. And if it's very much like a metronome, like 0.4, 0.4, 0.4, 0.4, that tells you that the sympathetic nervous system is actually in control of the show, and the parasympathetic has been downregulated. It's quirky, I know, but it's one of the things that we use to determine what stressor is driving the boat. So the sympathetic system becomes more active when we start to exercise. You know, there's a fight or flight response that happens when we start to move, and that triggers the sympathetic nervous system, and that then causes increase of heart rate. And it's a conversation of the balance that we have to be able to service the body, to be able to go from rest and digest to fight and flight. And I will tell you, some athletes will be able to control a little bit of this SNS and PNS balance and be able to, like I talk about all the time, if you have people who are competitive shooters, like the biathlons in the Winter Olympics, they're skiing, they're at a high rate, they're in a very SNS stage, but they've triggered or trained themselves how to basically downregulate the sympathetic nervous system and not have a stress response, fight or flight. And they're more on the parasympathetic side, and they do that through imagery, positive self-talk, any number of mechanisms that they can use to help downregulate that stress response. Especially so when they come into the range to shoot their targets, they want their heart rate quieted and very much in a recovery state so they can be on target and shoot those little itty bitty targets from however many meters away. But it's a trained response. They've taught themselves how to do that. Pretty amazing stuff. So with this diagram kind of presents this outline in terms of the rest and digest and fight or flight response, but it's also the shunting of blood flow that you have in the body. So when we're at rest, cardiac output, if you look at this in terms of the dots here, where, relatively speaking, how much blood is being shunted, most of it is rest and digest. Here we are in the organs, right? When we get into heavy exercise, well, in heavy exercise, there's very little blood that goes to the organs. It gets redirected over to the skeletal muscle. Whereas conversely, when you look at like rest, you have very little blood flow to the skeletal muscles, just enough to service and provide nutrients, etc., to keep us alive. But what happens is when you have a heavy bout of exercise, cardiac output goes from 5 liters per minute in rest to 25 liters per minute, so it's 5 times the amount. But notice the difference on how blood is shunted to a greater degree to the muscles as opposed to down here when we're at rest. And it just goes to show that kind of fight or flight that I mentioned, right? In terms of how much blood flow is required at a muscular level, 20 liters per minute versus at rest, 0.75 liters per minute. And how you have the shunting of rest and digest. And then we go to sympathetic nervous system where you have in heavy exercise, the muscles drive the boat. And the sympathetic nervous system is the one saying, hey, we need you to not worry so much about the vital organs. We're going to shut down the actual blood flow to a certain degree, just enough to keep us going. But what we really need to work on are the muscles so we can get up and run away from that tiger or catch that ball or whatever it may be. All right, signing off from this one, moving to the next one.